On this podcast, we love to talk about innovation, leadership, soft skills and hard skills that you need to master in order to be a successful pharma or MedTech business leader. But the reality is that none of this matters if you're not able to have consistent mental and physical well-being. To open a new dialogue about health and to ensure we go from career achievement to life alignment, I'm very happy to welcome Shirley Low from Johnson & Johnson to Amplifiz Pharma and MedTech Innovation Podcast. Before we start, please make sure to hit the subscribe button. Shirley, welcome to the show. You have been in MedTech for over 2 decades.
Yes.
With Johnson & Johnson for 15 years.
Yes, correct.
Pretty nice score. Congratulations.
Thank you.
Tell me a bit more about what professional or career success means to you.
Mm-hmm. Great question. So a lot of people in MedTech define their success by their tenure or their roles or how far they've gotten in their organization. But for myself, the definition is very different. And that is, of course, two things: that you've made an impact in your area of expertise. But secondly, that you've gotten to the later stages of your career and have been able to maintain the health that you can have to have energy and actually enjoy whatever you've built in life. So, I've seen way too many people that do not put that as a priority. And unfortunately, they have helped many others throughout the years in their health, because we're in MedTech, that's what we do. We help others in health, and they haven't been able to preserve their own. They seem inflamed, they don't have energy, and they, most importantly, are not able to give back to their loved ones, which is really what they want to be able to do.
How did you come about that realization? What's the backstory that led you to focus on it?
Well, it's quite a personal story. And back in 2018, I felt like I was having the worst health of my life, even though I'd always thought I was a fairly healthy person, tried to live a healthy lifestyle, but I was always very tired and had a lot of headaches, had difficulty maintaining my weight. I could do it, but with a lot of effort. Around the same time as well, my mother suffered a stroke. And I happened to be staying at home in Australia the night she had the stroke. And in the middle of the night, she was screaming. I thought she was having a nightmare, but in fact, she was having a hemorrhagic stroke. And being there happened to save her fortuitously, getting emergency care for her. And she was able to live another 5 years, but they were very poor quality of life years. And in that process, I really learned that the most important thing that we can do for ourselves is to be our own health advocate, to understand what we really need, to optimize what we do. And for myself, I kept looking for answers. The initial doctors would say, "Oh, you're just a young mom, that's what it feels like." But I knew something wasn't quite right about me. And eventually that led me to a functional medicine doctor who actually did look at my levels in a different way. Instead of, is it abnormal or normal, to say, is it optimal? And in my case, it was my thyroid and my iron levels, which were not optimal. Now, in another person's case, they may feel quite okay with those levels, and which is why it can still live in this so-called normal range. But in my particular case, I was experiencing quite a bit of symptoms. And the thing is, I could try and address those. And if my symptoms went away, then indeed that would have been the root cause. And it was the case. And I'm so glad I found those answers for myself, because then life resumed again. I had my energy back. I could function again. I could perform well. And I realized, having gone through that myself, that many others must be going through a similar journey.
Talking to this physician, and then by also obviously being very self-aware of how you felt every day and so on, you gradually were able to kind of pinpoint how to navigate these biomarkers to this optimal stage where you felt perfectly well, and indeed the numbers were reflecting that we're in this optimal window.
In fact, that's right. In fact, listening to podcasts like this one sort of got me onto this thinking that maybe there are other answers out there, and that's when I first thought to even look for a functional medicine doctor and integrative health. And what I mean by integrative is it integrates your own feeling and thought as the patient. How am I feeling? How am I trending? Alongside the science and data as well. So it's fully integrative. And I actually ended up studying some of that myself in additional courses to at least help myself and my family, and then be able to apply that and see if it actually works. And so far, so good. It is working.
Well, no, that's fantastic. And so you talked about your health that was not good in 2018. If you recall, how long does it take you to kind of turn things around? And
feel better? Yeah, I would say it's maybe about 3 months. So a pretty quick turnaround considering what I was feeling like. And to be honest, so I'm turning 45 next week, and I feel like I can do everything that I did in my 20s. In fact, there's nothing I can think of that I can't do that I could do back then currently. In fact, I feel like I can do more now.
That's amazing.
So, and alongside that, being able to, keep up the career, keep up the family responsibilities, because ultimately it's a bit like the airplane and oxygen analogy, right? You do have to take care of yourself first before you can take care of anybody else.
That's a very good point. And you picked up on sports as well, on some of them at least?
So I started marathon running at the age of 42. So I always think I started 42 at 42 because the marathon is 42 kilometers long. And it's been amazing in that I've learned so much in that process about pushing myself, understanding and testing if the protocols I put together for myself actually work. And indeed they do.
This is amazing. So that's well done to you. Kudos, because that's probably a tough one for sure. And, it challenges some of our thinking about, aging and performance and so on. So, but beyond that, what did you realize you were missing until that point?
A lot of us actually don't know what health really is. So a lot of us just may think we can just do our annual check, and if we get the pass, it's good enough. But to really understand what health is at an optimal level, this is something that helps us when things really do get tough, because eventually we will come across stressful situations at work, in life, and if we don't have that good foundation, we're not going to survive through those challenges as well.
And I think nowadays with biomarkers, with wearables, we all have the ability to become more self-aware and more interested in our own health, of course, which is great. But then there's a possible flip side to it, which is that we overstress on it, or since we are not all physicians, we might not exactly know what to track. So anyways, do you think there's any possible rabbit hole that we may fall into, or what's your take on that?
Yeah, certainly there's plenty of tests out there now, and they're being advertised left, right and center. And we can get into the rabbit hole where we can focus too much on that.
Right.
In case of not knowing what you're needing, it's a good start just to ask some questions, find people that have had similar issues that they've been able to overcome. And of course, talk to the right professional, a health coach or someone that you feel that you can trust, and just keep learning and finding out for yourself. It is a long journey, but it is definitely worth it, especially if there's something that you've been ignoring for years or putting aside for years. We're very good at setting KPIs for our business goals, but we just do not set them for our own health most of the time. And a health goal should be something very personal, something that you genuinely feel that you want to achieve. And it shouldn't necessarily be limited by what you think you can achieve. So I think having a short-term goal that is attainable and a sort of a longer-term dream goal is something that we should keep in mind, because once you've written that down somewhere, it starts to become real. And it could be for the short term something like, getting better sleep, feeling more relaxed, performing better. It could be really tracking yourself with wearables to know that you're trending better than you were, sleep scores and things like that. And for the long term, you can write something, I want to look good in a swimsuit again. It could be, for myself, it was to run a marathon. So I wrote that down before I'd run one. And at the time, it seemed very impossible, but I wrote it down anyway. And it just leads you one step at a time towards that goal. And of course, getting some sort of professional help to get you to that place really helps define what you want to do and also helps bring you through those challenging times when you could easily give up. Or
it's easy to give up, right?
Yeah,
it's
but
easier.
you remind yourself, why am I doing this in the first place?
Yeah. But that shows also how driven you are as a person. I mean, obviously, as you said, it's easier to give up than to fight through and focus on it. You talked about professional help, so we talked about the clinician and the medical aspect of it, but were you having also some trainers and some help on the, let's say, the more sport exercising side of things? Or no?
For sure. Currently I have a run coach. You can look into getting a dietitian, psychotherapist. It's really trying to work in a fully integrated team who can find all the areas that you could perform better in to serve that goal.
Right.
Just as a professional athlete would have all this help around them, why not get it for ourselves? A lot of people in the MedTech industry now, you've reached a certain quality of life, a success, you can start giving back to yourself in other ways, and not just the fancy dinners, right? There's other ways to give back to yourself. And one of these is to really find out how you can improve yourself and feel better.
Of course. Listening to your story and getting to know you more personally, it's funny how, first of all, we are exactly the same age. That's ironic. I don't think anyone watching this would have guessed. But beyond that, it's funny that you talked about that journey in 2018 because maybe 1 year after that or 2 years, not long after, I reached a stage where I was not taking care of myself, and it's been years and years of adding on bad sleep, poor food, lack of exercise. I mean, the terrible combo, right? And so I was like, okay, you better do something about your life, because I was not healthy. I was overweight. So I lost 40 kg, which is huge. But I mean, you know me and you see me, I'm a tall guy, right? So 40 kg on the big guy is doable. There was a lot to lose, a lot of weight to lose. But beyond that, then the energy, the morale, everything was more positive. Everything was more shiny and nice instead of, being depressing and so on. So it was a big change. And now, to your point, is the hardest part for now is to maintain that and keep it as a healthy lifestyle all throughout, instead of just, focusing on intensity, going to that level, and then rolling back down into bad habits of, lack of sleep or food and so on. So I'm trying to maintain that, but that requires persistence and efforts, that's for sure.
Well, first of all, congratulations. It's such a huge achievement, actually, to turn yourself around like that. And it's probably something that was on your mind, but at the back of your mind, and you may have had friends tell you need some help, but you ignored it, perhaps.
That's exactly right. I mean, for years I had friends, telling me this, and it was going in one ear and out the next. And when I was young, I was doing a lot of sports, and then gradually through my 20+ year of professional career, I was putting sports and, having this healthy lifestyle on the side. It didn't matter anymore, and I was all about business. So again, it's exactly what you are talking about. It's good to be driven at work, but obviously you should not have a price on how you feel and what you are as a person. So it's your story resonates a lot with my personal experience.
Amazing. Thanks for sharing.
Yeah.
And you brought up another interesting point, actually, which was that in terms of maintenance, as we get older, it may feel harder, and that in itself could be a health goal, which is to maintain what you currently have, so what you can do. And the thing is, you might not know what that is unless you do some proper baselines, some physical baselines, some body composition baselines. So things like this, apply the science to yourself, and this could be a very real health goal and achievable for many people.
Yeah. So from a professional standpoint, you have a role at J&J. So you're in charge of professional education in vision care, correct?
Correct, yes.
But you're also an advocate for the J&J Credo, is that right?
That's correct, yes. So it's Credo Champion for our STAR cluster in vision care. And this is a role that encompasses the philosophy that belies Johnson & Johnson, that was written over 100 years ago. And it really is talking about responsibility to patients and doctors, but also to employee welfare. And this is something that is of genuine interest for me, because I know that as MedTech professionals, we can do our best when we're feeling our best. And I'm genuinely impressed with J&J's culture and long-standing commitment to its employees with various programs such as Credo and Energy for Life, which is another one which is available globally for employees to really learn about how to maintain their energy, how to fuel properly, how to move. And I think this is, a great step forward in, above and beyond those, annual screenings and other services.
Yeah. And J&J is doing it for the genuine purpose of having people who are feeling well and perform well and so on. But why is it so important for leaders in our industry to be more aware of, well-being?
Yeah. So the data is definitely there in that if you're not feeling well, you're not as productive. So there's evidence to show that presenteeism can be 20 times more impactful than absenteeism. So presenteeism is obviously when we show up to work, but we're not capable, we're not functioning, and we're not delivering as best as we could. And it's much harder to measure, right? Because you're still there physically, but are you there fully mentally? And alongside that, there's absenteeism affects other workers who then have to take on the workload of those that are missing. And ultimately, having programs that support well-being helps with the employees just feeling valued in the workplace, and they want to be able to contribute and do more. So there's many, many different reasons why this is important for a startup or a huge corporation when it comes to the MedTech industry.
So for those listening, watching us, what is if there was one main takeaway that you would like them to take from this conversation and act upon, what would it be?
Don't wait. Start now. Almost everyone can make some improvements with their health, to be honest. And it means advocating for your health, setting those health goals, doing the research, and inevitably these things will help you in your career. Whether you're trying to do negotiations, when you have bright eyes and a great demeanor, people will resonate towards you, right? You'll be able to draw more success through your career by putting yourself first.
It's a good reminder of what really truly matters for all of us. Can I ask you another question? Mm-hmm. Are you scared of this?
Actually, I'm not.
No?
Because I feel that I am doing my best, and I have learnt how to optimize my health. And if I am so unlucky to have a diagnosis of cancer or something in the future, I won't have any regrets thinking, I should have eaten this or I should have done that. I have and am living the best life that I can possibly imagine. So this is what I would like to spread to others as well.
Wow, this is awesome. Thank you so much, Shirley, for coming on the show, for bringing so much energy, inspiration, and passion, and reminding us what truly matters at the end of the day. I hope you had fun.
Lots of fun. Thanks, Guillaume.
Thank you so much. Thank you all very much for watching this episode of Amplifiz Podcast. Please submit your questions, your comments, subscribe to our channel, and you can check Shirley Low LinkedIn profile in the description of this video. Thank you so very much, and see you soon. Bye-bye.